The management of bone disease in a patient with multiple myeloma is an important thing to keep in consideration. The use of bisphosphonates, either zoledronic acid or pamidronate, is appropriate. Current guidelines recommend that these be given for 2 years post diagnosis and then potentially stopped if the disease is controlled and reinstated when the disease is active once again. So, for a patient whose disease is demanding treatment again, like this 72-year-old individual, I would like to resume bone strengthening agent if it had been stopped. The use of Xgeva or denosumab has also been given the green light by the FDA recently. That is a drug that does I think have some advantages in some specific subsets of patients, especially those with renal insufficiency, where it is literally free of the side effect of renal damage that characterizes often the use of bisphosphonates. There is also some data to suggest from the trial that led to its approval that it may improve progression-free survival compared to the use of bisphosphonates. This case illustrates several salient features. I think that it brings forth the dilemma that oncologists face in the choice of treatment regimens both for frontline and relapsed refractory disease. I think that with the proliferation of treatment options, that is a good problem to be facing. In this patient, the use of ixazomib with lenalidomide and dexamethasone was an appropriate choice of therapy in my mind. I think that the use of other 3-drug regimens like daratumumab based, kyprolis based regimens may also in some people's eyes have been appropriate. However, the fact is that they are somewhat more inconvenient in administration. So, I think that one certainly is happy with the proliferation of regimens that one has to turn to. The dilemma of choice often I think falls on an individual and the patient. A conversation between the doctor and the patient is key to determine what is appropriate for a given patient. And often it is a question of how we sequence these regimens than truly a choice between this or this.